Thank you, Premier. Good morning. So it's been a busy but productive night, and we will continue to work at pace over the next few days to run this outbreak to ground in the way that we have dealt with our previous outbreaks here in Victoria. In terms of contact tracing, as the Premier said, there are now 20 family close contacts who are isolating, and we are putting our support around them, and pleasing to see some of the negative early results we've seen on two of those tests. More tests, of course, will be coming in over the next day or so in that area. We also are dealing with around 600 at this moment work close contacts. These are people that this individual has worked with over the 2-week period in the hotel quarantine program at the Grand Hyatt. All those 600 people have been instructed to isolate and to go and get tested, and all of them will be contacted today individually to discuss their movements and their exposure. We are, of course, reviewing with our colleagues in CQV any evidence we have of movements within the hotel, and we will do our best to obviously reduce that number of people and to identify any of those who may indeed be close contacts. But we are taking a very risk-averse approach at this point, and have asked all those 600 people to stand down, to isolate, and to ensure they get tested, and we will support them to do just that. We are also working with colleagues in Tennis Australia, around 520 players and staff who completed their quarantine at the Grand Hyatt. They have all been asked to and instructed to test and isolate today. There will be dedicated test facilities for them to ensure we get their testing results done and that we can then rule them out from the inquiry. They are casual contacts. We are not as concerned about them, but again, out of an abundance of caution, we want to ensure we leave no stone unturned in how we follow up and deal with anybody who may have had contact with this individual. With regards to the exposure sites, we now have 14 exposure sites. That's up from 8 when we last spoke to you last night. And again, we will continue our conversations and discussions today, not only with the individual, but any other positive cases that we may identify over the coming hours. So please keep an eye on that on those exposure sites. Anybody who has been at those exposure sites, and we have very precise time windows for those exposure sites, should immediately isolate, should get tested, and remain isolated for 14 days. We will be in touch with you if you come forward. We are, of course, working with those venues to follow up their contact tracing systems, and again, we'll be reaching out that way. But if you have been at those locations, and there are some quite big locations there in those time windows, we need you to isolate and to go and get tested and to remain isolated for 14 days or until you hear otherwise from us. With regards to testing, first I'd like to thank all those Victorians right now who've either got tested already this morning or have been waiting to get tested in the last few hours. We had 13 sites open, some before 8 o'clock, most of them between 8 and 8:30. We have additional lanes and capacity on all of those sites, and some of them are very busy. We are moving some people between sites. I have some sites that have waiting times of around an hour and a half. I have one site, the Springers Leisure Centre, that 10 minutes ago, was running at around 4 hours, and we are looking to move some of the people onto other nearby sites. That work will continue throughout the day. Our website has live information about the length of queues. We'd ask you to check before you go to the site that you want to go to make sure that the queues there are not excessively long, and if there is a site that may be a little further away but that may have shorter queue times, then that would be my advice to go and pursue that. We are setting up an additional 4 or 5 sites today. There will be a site opening up at Noble Park during the course of this morning. We're working on sites at Monash Health in Clayton, at Brighton and in CBD, and we're exploring 1 or 2 other sites in Bayside. That work will continue throughout the day, and we will advise as and when those sites go live. This is all about creating the capacity, not only for the people who are in that close contact field, but for any Victorian who at this point feels that any concerns that they may have been in contact with this individual, or that anybody who is displaying symptoms. As the Premier has said, we know this virus is wildly infectious. We know it is still now an issue for us to deal with yet again. We will, as a Victorian community, deal with this in the same way as we always do, which is that we will act swiftly and promptly. I apologise for any delays that you're going to experience this morning if you're standing in those lines, but it is an important thing to complete today, and we will ensure that the testing capacity is there today, tomorrow, over the weekend, and as long as is necessary to run this particular outbreak to ground. And finally, with regard to wastewater testing, we are now conducting daily wastewater testing, particularly in the southeast water catchment. We of course do at least bi-weekly across the rest of the state. At the moment, those results are negative as of Tuesday, but we will continue to watch those results very closely and follow up any traces that we do find. And with that, I'll hand back to the Premier. Thank you.